Are you considering using Annovera as a form of birth control? Before diving in, it's important to familiarize yourself with the potential side effects that often go under the radar. In this video, we unveil the hidden side effects of Annovera, giving you a comprehensive understanding of what to expect. While Annovera is a highly effective contraceptive option, it's not without its drawbacks. Most users experience minor side effects, such as headache, nausea, and breast tenderness, which are usually temporary and subside after a few months. However, there are certain hidden side effects that may catch some users off guard. In this video, we'll delve deeper into these hidden side effects and offer insights on how to navigate them, so you can make an informed decision about using Annovera as your chosen contraceptive method. The benefits of using Annovera. Annovera is a novel contraceptive option that was approved by the FDA in August 2018. It's a small, flexible, reusable ring that is placed in the vagina for 21 days, followed by a 7-day ring-free interval. The ring releases a combination of hormones, segesterone, acetate, and ethinyl estradiol, that prevent ovulation and thicken cervical mucus to block sperm. One of the main benefits of Annovera is its long-lasting effectiveness. Unlike other forms of birth control that require daily or monthly administration, Annovera can be used for up to 1 year before it needs to be replaced. This makes it a convenient and low-maintenance option for women who want reliable birth control without the hassle. Another advantage of Annovera is its flexibility in terms of use. It can be inserted and removed by the user herself, without the need for a healthcare provider's assistance. This gives women more control over their own reproductive health and allows them to use Annovera discreetly and comfortably. Common side effects of Annovera. Like any hormonal contraceptive, Annovera can cause some side effects, although they are usually mild and temporary. These common side effects include headache, nausea, vaginal discharge, breast tenderness, mood changes. Most users report that these side effects subside after a few months of use, as their bodies adjust to the hormones. However, if the side effects persist or become severe, it's important to talk to a healthcare provider about adjusting or discontinuing Annovera. Less common but more serious side effects of Annovera. While rare, there are some more serious side effects of Annovera that users should be aware of. These include blood clots, stroke, heart attack, liver problems, high blood pressure, gallbladder disease. These side effects are more likely to occur in women who smoke, are over 35 years old, have a history of blood clots or stroke, or have certain medical conditions such as diabetes or high cholesterol. It's important for women to disclose their full medical history to their healthcare provider before using Annovera, so that any potential risks can be evaluated. Precautions and warnings when using Annovera. In addition to the common and serious side effects of Annovera, there are some precautions and warnings that users should be aware of. These include: the risk of sexually transmitted infections, STIs, is not reduced by using Annovera. Women who use Annovera should also use condoms or other barrier methods to prevent STIs. Annovera may affect the accuracy of certain laboratory tests, such as liver function tests and thyroid function tests. Women who use Annovera should inform their healthcare provider and laboratory personnel of their contraceptive use before undergoing any tests. Annovera may interfere with the effectiveness of certain medications, such as anticonvulsants, antibiotics, and HIV medications. Women who use Annovera should inform their healthcare provider of all medications they are taking, to ensure that there are no interactions. Tips for managing side effects of Annovera. While some side effects of Annovera are unavoidable, there are some tips that can help manage them and make the experience more comfortable. These include taking Annovera at the same time every day, to maintain consistent hormone levels. Using over-the-counter pain relievers, such as ibuprofen or acetaminophen, to manage headaches or cramps. Eating a balanced diet and staying hydrated to help alleviate nausea and improve overall health. Getting regular exercise and practicing stress-reducing techniques, such as yoga or meditation, to manage mood changes and anxiety. Alternatives to Annovera. While Annovera is a convenient and effective form of birth control, it may not be the right choice for everyone. There are several alternative options available that may better suit individual needs and preferences. These include hormonal methods, such as the birth control pill, patch, or injection. Non-hormonal methods, such as condoms, diaphragms, or copper intrauterine devices, IUDs. Natural family planning methods, such as tracking ovulation and using barrier methods during fertile times. It's important to discuss these options with a healthcare provider and choose the method that best meets individual needs, taking into account factors such as effectiveness, convenience, and side effects. How to talk to your healthcare provider about Annovera. If you're considering using Annovera as a form of birth control, it's important to have an open and honest conversation with your healthcare provider. This can help ensure that Annovera is the right choice for you and that any potential risks or side effects are properly managed. Some questions to ask your healthcare provider include: what are the potential side effects of Annovera, and how can they be managed? What are the risks associated with using Annovera, and how do they compare to other forms of birth control? How effective is Annovera at preventing pregnancy? What should I do if I experience side effects or have concerns about using Annovera? Real-life experiences with Annovera. While the side effects of Annovera can vary from person to person, hearing about real-life experiences can be helpful in understanding what to expect. Here are some experiences shared by Annovera users. I've been using Annovera for 6 months now, and I love it. It's so convenient, and I haven't had any major side effects. The only thing I noticed was some nausea in the first few weeks, but it went away on its own. I started using Annovera and noticed that I was more irritable and anxious than usual. I talked to my healthcare provider, and we decided to switch to a different form of birth control. I was hesitant to use Annovera at first, but my healthcare provider explained all the benefits and potential risks to me. I've been using it for 3 months now, and I feel much more in control of my reproductive health. Conclusion: is Annovera right for you? While Annovera can be a highly effective and convenient form of birth control, it's not without its potential side effects and risks. It's important for women to fully understand these before making a decision about whether or not to use Annovera. By familiarizing yourself with the common and less common side effects of Annovera, taking precautions, and talking openly with your healthcare provider, you can make an informed decision about whether or not Annovera is the right choice for you. Thanks for watching.